my name is Abby. I'm going to be your student nurse today. Can you verify your name and date of birth for me?
Matthew Dallin, May 5th, 2006.
Okay, I'm going to check your wristband over here. I'm going to shut this door for privacy, and I'm going to do some hand hygiene. So the doctor ordered for you to get your vitals. We're going to do a respiratory and cardiac assessment, and we're going to go over some fall risk and the preventions we can do for that. Is that okay with you?
Yes.
Okay. At this time, we would do your blood pressure, your pulse, and your respirations, and then we're going to go over pain. And then, so we are going to start off with doing your cardiac assessment. I'm going to start off by listening over here, your aortic. Can you lean back for me? Listen to your pulmonic. Erb's point. We're going to go down to tricuspid. And then we're going to do mitral. And then we're going to listen to your apical pulse. Alright. And now we're going to listen to your lung sounds. Start off with the and now we're in your left lower lobe. Okay, your right lower lobe. Can I get you to put your arm like this for me? And listen to your lateral. Okay, we're going to do this side. Can you do the same thing for me? Put your arm up here. Okay, now we're going to do your back. Alright, your heart and lung sounds all sound good. For your heart, are you having any chest pain or anything?
Yes.
Okay, and what's the quality of that chest pain?
Probably about a 7.
Okay. And does anything help with it at all?
No.
Okay. Alright, and so now, can I get you to lean back probably about a 45-degree angle? And can you put your head back for me? I'm going to check for JVD right here. Okay. I'm going to come to this side and do the same thing. I'm going to check for JVD. Okay. And now I'm going to listen to all your pulses. Listen to your carotid. Go over here and do the same thing. Okay. And this one. This is your radial. And we'll listen to this one. Can you lift this up? Lift this up. We'll listen to your brachial. And then I'm going to have you do this. And this would be your auxiliary. Okay. And then we're going to listen to your femoral. Okay. And then we're going to listen to your popliteal. Okay. And we're going to hear and listen to your here. Can I actually have you take your shoes off for me? Now we're going to listen to your dorsalis pedis. Okay, and now I'm going to check your capillaries, make sure they're refilling okay. I'm going to check right here for warmth of your skin. your capillaries are refilling within 2 seconds, which is good. I'm going to do skin charger. Okay, and I'm going to check for edema. I'm going to do the same thing with capillaries. Okay. I'm checking for edema. Okay. And then your skin charger. Okay. And let's see. For your walrus, do you have any? Actually, do you have any? Have you had any signs of shortness of breath, like losing breath? No. Okay. Okay. And now we are going to go over doing your fall. Have you fallen recently?
No.
No. Okay. And do you have any do you have any medical history, any secondary diagnosis that we need to know about?
I have POTS.
Okay. And do you use any assistive devices?
No.
No? Alrighty. And you are not on an IV, so we're going to rate you at about a 15 for your MORE scale. And so that is going to be low risk. We were going to go over what you do to prevent falling. Anything around you. Make sure your shoes aren't on the floor like that. We would get you to move those when you get up. You wouldn't fall. Make sure lighting is good. So if your lighting's like this, we make sure when you get up, you want it to be on high. Okay. And we're going to make sure you have your belongings next to you, so you do have your phone, which would be good. And for your respiratory, if you were bed bound, we would have you be doing a turn breathing cough. This we would roll you over, we would assist you, make sure you feel comfortable. We would have you breathe in, and then we're going to have you exhale, breathe in a couple times, and we're going to have you cough a couple of times. And then we do have an incentive, and that's where you're going to blow in. It's called an incentive spirometer. And you're going to blow in for about 5 seconds. You're going to hold that breath, and then you're going to let down. You're going to do that a couple times. This is something that you would do on commercial breaks. You're going to do it about 10 times an hour. This is just something to help you with your breathing and opening up those alveoli. Do you have any history of hypertension, anything like that?
Mm-hmm.
Okay, this will go with your blood pressure. Make sure that you don't have high blood pressure or anything. Do you have any questions for me?
No, ma'am.
Thank you.